Hello and welcome to our COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Good morning, Minister. How are you today?
I'm good.
Okay, Minister. Now, before we get into COVID-19, I want to speak a little bit about filaria. I know the campaign was launched in Region 1. Can you tell us how that was?
Well, we had a good launching in Region 1 on Saturday, and we had a good turnout. We had a number of pill distributors who came out and other influencers in the community. So I suspect that the rollout of the filaria campaign in Region 1 is going to be very strong. The last time when they had such a campaign, they were able to get at least 74% of the people taking the medication. And we hope that they can do the same or even be better this time around. And from the enthusiasm that I saw, I think we're going to do better.
Okay. How many regions has the campaign reached to date?
So far we had concentrated on Region 4 and then Region 3. And then we now move the campaign along to Region 6 and 10. So we had the campaign running in these 4 regions, but as of Friday and over the weekend, we did the launching, the official launching, but the campaign really starts today. And that's going to happen in Region 1, Region 2, Region 7, and Region 5. So 4 other regions are going to join, and we'll continue the rollout. As of yesterday, we had 363,932 persons who took the tablets. So that's, I think that's really good. And with the 4 new regions coming on board, we expect to take that number up quite higher.
Okay, Minister. Now, thank you for that. Let's turn our attention to COVID-19. I know yesterday we would have received the consignment of vaccines from India. What are your thoughts on the latest shipment?
Well, we are very grateful to the government and the people of India for donating the 80,000 doses. As you know, the AstraZeneca vaccine, we have to give 2 doses per person. So these 80,000 doses would help us to vaccinate 40,000 people in Guyana. What we are trying to do, we have also received 20,000 Sinopharm vaccines. So in total, we now have vaccines to immunize at least 50,000 persons. So as I've said before, the ministry has a plan of how we are deploying these vaccines. Our first preference is to ensure that our healthcare workers are able to get the vaccine, so they are going to be given first preference. And these are healthcare workers both in the public and the private sector. So now that we have these vaccines, we are going to offer it first of all to healthcare workers across the country and to make sure that they get these vaccines first. The reason being is that healthcare workers, they are at higher risk because they interact with the public, they interact with a lot of sick people, and there's that possibility that they themselves can become infected with COVID from a person who has COVID. So we want to make sure that they are properly immunized, and that's why we are offering the vaccine to them first. In addition to the healthcare workers, we also want to offer it to older people. So the next in line after healthcare workers will be older people, 60 years and above. And the reason for doing so is that when we look at the mortality profile of those who are dying from COVID, or those who get the worst form of COVID, it shows that older people are more affected. And because of their risk, we have seen more deaths among older people. And again, we believe that if we immunize older persons, then we'll prevent them from dying. and that's why we have targeted older people. So for this 50,000 doses that we currently have, our priority are going to be to give to the healthcare workers and persons about 60 and above, age 60 and above. So I think that's very important for people to understand. We also are going to look at persons with comorbidities, and we understand that a lot of older people would have comorbidities. So once you're 60 and above, you will be able to get the vaccine, at least in this round. Now, one of the challenges that we have been having when we started with the first 3,000 doses was that there were people who wanted to jump the line. So they did not want to wait their turn, and they will turn up at our vaccination sites and probably try to impersonate healthcare workers. With this 50,000 persons that we'll be immunizing, we'll require stricter documentation, if you like. So we'll be asking people to walk with their ID card so that we can verify who they are and take the relevant information. And if there are persons who are jumping the queue and we discover them, then they're going to face stiff penalties, because we don't want people to jump the queue. We want to make sure that we are able to prioritize these vaccines to people who need them the most and who are most at risk. Eventually, we'll get vaccines for everyone in the country, but at this stage, as we get a limited amount, because we only have 100,000 doses now, that we want to make sure that we give it to the right priority groups. And I hope that, people can understand that, because if we give it to the right persons, then we are going to protect those persons, especially the elderly. We are also expecting later in the month 100,000 and 800 more vaccines through the COVAX mechanism. And once we get this, then we'll be able to expand to other priority groups. But with this current amount that we have of 100,000 doses, which would cover 50,000 people, we are going to spread it across all regions of Guyana. And our priority group as of now are going to be healthcare workers and, of course, the elderly, persons 60 years and above. We have had some requests for parliamentarians to take the vaccine, and we are going to consider that during this current round, because there are not many parliamentarians, and we think we'll be able to cover them. So those parliamentarians who would be interested in getting their vaccine, we'll make those vaccines available in this round.
Okay. Minister, just for clarity's sake, just now you said we'd be expecting 100,000 plus 800 vaccines from COVAX, am I correct?
COVAX, yeah.
Okay, so it'd be...
So in addition to this 100,000 that we currently have, which is 20,000 from Sinopharm, a donation from the Chinese government, we have the 80,000 that came in from the government of India. So together, that is 100,000 doses of vaccines that we currently have. So we are going to use these 100,000 doses to ensure that all healthcare workers, both public and private, are now covered, and we start immunizing older persons 60 years and above. As we get the other set of vaccines, and we expect the 100,000 from COVAX, once we get those, then we'll be able to expand the groups to other category of persons. But we will facilitate members of parliament in this current round, meaning with this 100,000 doses that we currently have.
Coming back to the healthcare workers, you said both public and private persons in the sector. Have we started vaccinating healthcare workers in the private sector?
Yes, because when we got the first 3,000 doses, we offer some of those doses to private sector uh, healthcare workers as well.
Okay, and to date, can you say how many healthcare workers across the board have been vaccinated?
I don't have the number on hand, but I can easily get that number. So maybe the next time we speak, we'll be able to talk about that.
But now, before we come off of the healthcare workers, now that we have two sets of vaccines, will they be get the opportunity to choose which one they want, or that's already decided?
Both vaccines are very effective, and we are going to distribute it to all the regions so people would be able to get either the Sinopharm or the AstraZeneca. The Sinopharm vaccine is, as you know, 79.4% efficacious, and the AstraZeneca one, once you have a prolonged interval between the first and the second dose, meaning about 12 weeks in between, that goes up to about 82%. So they're both within the same range of effectiveness, and they'll do a good job in protecting people from getting the infection and preventing people from getting the more severe form of the disease. So I think looking at the data, they're equally effective.
Okay, Minister. Now, I know four vaccines have moved to phase 4 trials, the Oxford AstraZeneca, the Moderna, the Pfizer, and the Sinovac. Can you explain what this entails, especially for the AstraZeneca vaccine?
So when we talk about phase 4 trial, um, phase 1, 2, and 3, phase 1 is when you look at what doses might be appropriate for humans, how it works, safety, and so forth. So 1 and 2, that's basically what you look at. And then phase 3 is really to see in a larger population how people would react to the vaccine and whether it's really protective. Now, all of these vaccines that you mentioned, the Moderna, Pfizer, AstraZeneca, and Sinovac, and some others, you have Sputnik, you have the Sinopharm vaccine, the Johnson & Johnson vaccine. They've all gone through the third stage clinical trials, and they've all gotten good results. But phase 4 now is when you actually implement it in a given population. So you're now doing it on a wider scale. And mind you, at the phase 3 trial, many of these vaccines would have enrolled thousands of people. At a minimum, they had like 15, 20,000 people being enrolled for the phase 3 trials. So in phase 4, it's really using the vaccine in a population and then observing to see whether or not the findings that you had in the clinical trials, the phase 3 trials, whether they're holding up. And in many cases, the vaccines are doing much better than was anticipated by the clinical trials, the third stage clinical trials. So that is going to continue. These observations for at least 6 months once vaccinations have started. And it also gives a chance to see whether or not there were other side effects that was not discovered during the clinical trials and things like that. So the monitoring after immunization, after people getting their vaccines for at least 6 months, is to just confirm the safety of the vaccine, to discover whether or not there are other side effects that we didn't know about, and to generally get a better understanding of how the vaccine works in a larger population.
Okay, Minister, thank you for that. Now, before we wrap up, I have a question from the Kaitro News. They're asking if you can please expound on the plan to roll out the vaccines to teachers, because I know last week you would have mentioned that the government is looking to do so.
So basically, our deployment or rollout of vaccines, we can envisage it in maybe 4 phases. The first phase, where we want to prioritize our healthcare workers, we can say that is phase 1, maybe A. right? Then phase 1B would be older people. Phase 1C would be persons with comorbidities. Phase 1D would be other essential workers like teachers. Then we go to a second phase, and of course, when we're talking about older people, we mean 60 years and above. Second phase, we're looking at persons 50 years and above, and in this second phase, we can include also the joint services. And then we go to the third phase where we'll take everybody 18 years and above, right? And in that way, we'll be able to cover substantially all the persons who we need to get immunized. We also envisage a fourth phase, and that fourth phase is to immunize children. But as of now, none of the vaccines that are currently available can be used to immunize children. We anticipate that maybe in another 6 months or so, that the clinical trials using children, the data from those clinical trials would be known, and that the WHO and other regulatory bodies globally would be able to make a pronouncement on the use of vaccines in children and what would be the appropriate doses and so forth. So once that information becomes available, then we will probably do the phase 4, which would include immunizing children. But as of now, we cannot do that because none of the current vaccines are available for children. So that's how we intend to roll out.
Okay. With the immunization of teachers, this would see some schools being reopened?
Once we start rolling out, as I said, we have them in the phase 1, but they're later down in phase 1. And once we get to them, they'll be immunized. And again, once we immunize people, they're protected.
Okay. Thank you very much for that, Minister. This has been our COVID-19 update. For more information, visit our website, dpi.gov.gy, or our social media platforms.